Let's talk about whether uterine fibroids, if left unremoved, can become cancer. Are there ways to identify these cancers without having a surgery? Let's talk about whether uterine fibroids, if left unremoved, can become cancer. So, what is the true incidence of cancer in uterine fibroids? Western data says that the incidence of fibroids being a uterine leiomyosarcoma, which is a form of cancer, is extremely rare. It could be anywhere between 1 in 350 to 1 in 1000 patients. So, and in this case, even if it was, are there ways to identify these cancers without having a surgery? So, using MRI imaging, which allows us to differentiate different kinds of tissues using certain tissue contrast and dye, and also look for certain features like tissue breakdown, which is higher in cancers, we're able to differentiate about 80 to 90% of these cancers using MRI imaging. So, and also there are certain blood markers like LDH, which also helps us identify whether these are cancers. And the third important thing is usually cancers occur above the age of 40 to 45. So having these three things in mind, many times it is quite simple to differentiate a uterine leiomyosarcoma or a cancer from a simple uterine fibroid. And given the very rare incidence of these conditions and the fact that we can pick many of them using imaging, I think there is an unnecessary anxiety in women which forces them to have a hysterectomy with a suspicion that this fibroid could be a cancer. And we see this quite often. It is very important to understand that the uterus is not just a reproductive organ, it also has other functions. And removing this uterus leads to unnecessary side effects and a poor quality of life that they can encounter later. So what are the common side effects that we see in women having a hysterectomy? Foremost, the uterus is also a support structure to the pelvic floor. Removing the uterus could lead to about 5 times higher incidence of pelvic floor dysfunction or pelvic floor prolapse, which is a condition where the pelvic wall of women is weakened. And this could lead to further side effects or complications like organ prolapse, where the bladder or rectum can prolapse through the pelvic floor. These are more serious conditions which again require extensive surgeries to make the patients come back to normal. So that is the first and foremost thing that we need to be aware of. And apart from that, having a hysterectomy before the age of 40 is related to almost 5 times higher incidence of heart conditions like congestive heart failure and coronary artery disease. And this has been shown in a 2018 study from Mayo Clinic, which is one of the most prestigious academic institutes in the world. And apart from that, also hysterectomy can cause early menopause because uterus also supplies some percentage of blood supply to the ovary, and removing the uterus can compromise the blood supply to the ovaries, which could lead to early menopause. And early menopause is associated with other conditions like loss of bone density and other hormone related issues. So it's very important for women to be aware of their treatment options when it comes to uterine fibroids. We have amazing non-surgical techniques like uterine fibroid embolization, which has been around for nearly 30 years. It is an FDA approved procedure. It's part of the American College of Gynecology guidelines, and it is tried and tested method to shrink these fibroids without unnecessary surgery. And all it requires is a daycare procedure through the blood vessels, using a small pinhole access in the groin or the hand, and using fluoroscopy and angiography. We use small catheters to go into the blood supply of the uterus and cut off the blood supply to the fibroids, which shrinks them without needing a surgery. And also there are other surgical options that gynecologists can offer for women who wish to preserve their uterus, like myomectomy. And if the patient does qualify for a myomectomy, that is, though it is invasive, it is still better than a hysterectomy. And when patients want to avoid surgeries, there are treatments like uterine fibroid embolization, which have quick recovery, avoid unnecessary surgical complications like adhesions where organs can stick together in the operative field, which is quite common, and this can lead to other conditions like bowel complications or chronic pelvic pain and other conditions that can occur because of surgery can be avoided using minimally invasive techniques like uterine fibroid embolization. So for women suffering from uterine fibroids, it's very important to understand all your treatment options. Ask your gynecologist about uterine fibroid embolization or myomectomy apart from hysterectomy. Understand your options. know which best suits you, and then take the right decision to cure your fibroids. And preserving an organ is any day better than having it removed. So uterine fibroid embolization and myomectomy are very important treatment options that women who suffer from uterine fibroids need to be aware of to have an organ preserving treatment that preserves their quality of life later.